Jana, thanks. Exclusive new details tonight out of the Holyoke Soldiers' Home, reeling from one of the worst coronavirus outbreaks in the country. Now they're getting ready to allow visitors to see their loved ones once again. On June 15th, state officials say outdoor visits will be allowed to begin, and the home has finished retesting their residents in preparation for the reuniting. But how will the workers be protected going forward to avoid another outbreak? Western Mass News reporter Audrey Russo is getting answers from Holyoke.
Visits will soon begin here outside at the Holyoke Soldiers' Home, and it'll allow residents for the first time in months to see their loved ones again. And although safety precautions will be taken, it is possible that the residents and staff could be exposed to coronavirus again.
People are scared to do their job. I think that affects what happens in the facility.
Since March, 76 Soldiers' Home residents have died after testing positive for coronavirus. Countless others were infected, but state officials say fewer than 11 remain COVID-19 positive after another round of testing. But dozens of workers also got sick from the illness during the outbreak at the state-run facility. And as Western Mass News has documented in the past, employees had limited access to personal protective equipment during that time. It's something the unions representing the nurses and certified nursing assistants want to see change in the future.
We also may look at certain standards of PPE.
Officials with the Massachusetts Nurses Association say their contract with the state expires in late December. ROLAND, the M&A director of strategic campaigns, says the COVID-19 outbreak has changed how they plan to negotiate the new contract on behalf of the facility's nurses.
I think will be a little bit more urgent.
Particularly when it comes to short staffing.
We had some ongoing issues at Holyoke, both in people being afraid to speak up and also some staffing issues that are long-standing. They're exacerbated under the previous administration that is now out.
Nurses who used to work at the Soldiers' Home tell Western Mass News that in the past there have been mass exits of employees who were offered early retirement.
It's often not so much used as a way to kind of change staff over and hire new staff, but more as a budget mechanism to try to save some money and have people exit.
GOFF is concerned the coronavirus pandemic has lowered the state's revenue this year and could spark another early retirement program.
Wouldn't be looking for people to exit without a guarantee that, one, they'd at least refill everyone who left, and also would fill more than the people who left, because we can't go through this again.
Those contract negotiations are still ongoing. SEIU Local 888 is the union representing the home's certified nursing assistants, or CNAs. Union officials say their contract with the state ends sooner, at the end of June. A 2019 Suffolk University study showed that of the staffing at the Soldiers' Home, licensed practical nurses and CNAs were difficult to retain. In 2018, 50% of all new hires left before the year's end. The turnover rate for CNAs was slightly higher than the industry average, and the LPN turnover rate was much more elevated.
For years, the members of SEIU Local 888 at the Holyoke Soldiers' Home have been talking about understaffing and forced overtime, which is a result of not being able to recruit and retain qualified help at the home because of the low pay and the difficult working conditions.
Rand Wilson is the chief of staff at SEIU Local 888 and says the home's leadership at every level has been resistant to their requests for better working conditions.
Our pleas to change the situation and to have the employees' voices heard and respected were ignored.
He says the CNAs who spoke out about the conditions in the Soldiers' Home during the outbreak deserve to have their jobs protected.
Providing good quality care for the veterans, and that's what motivated their desire to expose these working conditions.
The state recently announced that the interim superintendent, Val Liptak, will remain the head of the home for the foreseeable future. We reached out to the state for a comment on how they plan to address the next round of contracts. Wilson hopes the state will make health and safety a priority for frontline workers.
With the pandemic and the subsequent terrible mismanagement of the situation at the Holyoke Soldiers' Home has, I think, led to a new respect for the frontline caregivers.
State officials have said that the staff will be retested too, so when the visitors are allowed to come back next week, the employees should have a good understanding of what their COVID-19 status is as the outside world can enter the premises once again. In Holyoke, Audrey Russo for Western Mass News.